The role of implants in elderly patients is mostly positive, I would say, definitely positive. It is a huge benefit for our patients. It helps their quality of life, and it gives them, especially I would say for patients that are completely edentulous, it gives them a huge change, a huge impact in their quality of life, in their everyday life, not only for eating, chewing and functioning, but also in their social activities. It gives them a lot of satisfaction, so it's mostly a positive role, I would say.
It's a very interesting question to look at this relationship between infections, mainly pneumonia, and the hygiene of the mouth. And as we have many diseases in older patients, such as dementia, that are related to swallowing problems, and this leads very often then to swallowing disorders with the result that you have bacteria coming from the mouth region into the lungs. And this way it's very often, mainly in disease-related stages of older patients, that you are facing infectious problems.
The concepts are every time the same. Cleaning, the nurses have to do the cleaning of the tooth very, very well. That's the only situation.
Well, certainly in my area, for patients that are needing care when they're in the care homes, one of the big problems that they have is the costs, and they have so many other problems that if they don't actually have a problem in the mouth, it's a bit the attitude as well, let's just leave it. It's not the biggest problem I have at the moment. One of the things that we have to do is to try and encourage them and explain to them that this is something that they do need to be taken care of, that it does have an effect on their long-term prognosis. One of the ways to do that would be to introduce mandatory checkups when they come into the care home, so that they see what is going on in their mouth, that they know what's going on in their mouth, and that the carers know what's going on in their mouth, so that they can then encourage them to take care of their mouths.
Well, that's a good question. You know, what kind of changes in the post-operative phase? I would say the major problem is here that we only see patients normally for a couple of days. You know, they might be a little bit disoriented or they are anxious, but it's very difficult to predict this outcome. And the most important thing is, even it's major surgery, it's not a kind of surgery as a risk factor for aggravated post-operative cognitive dysfunction. So I would expect that they are more or less the same. Maybe for a couple of days they have impaired function. They can also have a delirium, which is well known, but then I would expect that they hopefully are at the same level. It's also, I think, dependent on the type of surgery, how invasive it is, but also on the anesthesia. It's very important for these patients to have balanced anesthesias and to really take good care of them, also in terms of pain in the post-operative phase.